You know that feeling? When you're sitting in like a packed hospital waiting area,
Mm-hmm.
it's a unique kind of people watching, isn't it?
It really is.
You see everything, quiet anxiety over here, maybe someone getting a bit frustrated over there, someone totally zoned out on their phone.
Oblivious, yeah.
Yeah, oblivious. And it really makes you wonder about the unspoken rules. Like, what are the rules for these places?
Right. It's more than just, basic manners.
Have you ever really stopped to think about what makes a good waiting room experience, or maybe a not so good one?
Well, that's exactly what we're getting into today. We're doing a deep dive into the etiquette of outpatient department waiting areas, OPD areas.
Go.
And it might seem like a small thing, right? It's just waiting. But how we act in these spaces, it actually has a pretty big impact on the whole patient experience, bigger than we might think.
Absolutely. And for this, we've looked at some really interesting sources. We've got info from Joint Commission International Law. They're all about global healthcare quality and safety.
Right, the big picture standards.
Exactly. So their view helps connect waiting room experience to like overall healthcare goals. Then there's the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
More on the standards front.
Yeah. And then we dug into more practical stuff from Supreme Medic Consultancy. They have a podcast called Lifelines and blog posts too.
Oh, interesting. Real-world advice.
Totally. Plus insights from the HospiMatch blog and even some quite lively discussions over on Quora about hospital etiquette.
So quite a mix.
Yeah.
From the high-level quality standards down to, what people are actually saying and experiencing day to day.
Exactly. It gives us this really well-rounded view.
And our goal here really is to pull out the important bits of, respectful behavior in these waiting rooms.
Yeah, think of this as your guide to being, well, a better waiting room citizen, maybe.
Something like that.
Our mission is basically to give you practical tips so you can navigate these areas with more confidence and, importantly, consideration. It just makes it better for everyone, yourself included.
One of the Supreme Medic blogs had a great line, something like, "Healthcare starts before you enter the doctor's cabin. How we wait matters, too."
That sums it up perfectly. So, yeah, let's unpack why these waiting areas are actually so significant.
Okay, where do we start?
Well, first off, you have to remember, these aren't just lobbies. They're places where people often arrive feeling pretty vulnerable.
Right. You might be worried about your appointment, stressed about a diagnosis.
Exactly. Or just feeling unwell, maybe in pain. So the atmosphere in that room can either, make things worse or actually help calm things down a bit.
That's such a key point. It's not like waiting for a bus. There's usually some underlying anxiety there.
Precisely. So a calm, respectful, organized environment that can genuinely be soothing. But if it's chaotic or people are being inconsiderate,
it just ramps up the stress.
It really does. So those little things, those minor etiquette breaches we might not think much about, they can actually have a real impact on how other people are feeling. And it's not only about fellow patients, is it? It's also about showing respect for the hospital staff. They're often under a lot of pressure.
Absolutely. So, okay, keeping that in mind, let's dive into some of the common mistakes. The things to avoid, what tends to disrupt that waiting room environment the most. Noise seems like a big one.
Oh, definitely noise.
Yeah, it comes up again and again. Supreme Medic's Lifelines podcast, lots of the articles we read, talking too loudly is a major issue. And unfortunately, loud phone conversations seem to be, well, a classic offender. There's actually research showing that noise in hospitals can increase anxiety and even affect things like heart rate.
Wow, really? So it's not just annoying, it's potentially like physically stressful.
Exactly. It underlines why keeping noise down isn't just polite, it's part of creating a better healing environment, you could say.
That makes sense. Because you might be trying to gather your thoughts or just stay calm, and suddenly you're hearing every detail of someone else's phone call.
Right. And it's not just voices. Lifelines also mentioned loud ringtones. People on video calls without headphones.
Oh, yeah. Or playing music out loud. That really breaks any sense of calm.
Totally.
Yeah.
And, hopefully it's less common, but one source even mentioned things like gossip or actual shouting.
Yikes. That would be awful.
Yeah. So the fix is pretty straightforward, right? Keep your voice down. If you have to take a call, maybe step outside or find a quieter spot if you can.
Right.
And definitely put your phone on silent or vibrate. Use headphones for music or videos. Basic stuff, really.
Seems obvious, but clearly it needs saying. And related to phones, Lifelines also mentioned just the general way people use them, not always about volume, but just being kind of lost in the phone. not aware of the shared space.
Yeah, it contributes to that feeling of distraction or unease for others.
Oh,
Okay, so moving from sound to physical space, personal space is another big one.
oh, for sure.
Lifelines mentioned this too. Ignoring personal boundaries can make people really uncomfortable.
Especially when it's crowded, or you're already feeling a bit on edge or unwell. Someone plopping down right next to you when there are other seats, it feels intrusive.
Definitely, it increases that anxiety. So the simple thing is just be aware. Look around. Don't sit unnecessarily close if you don't have to. Give people that little buffer zone.
Yeah. And speaking of space, another thing that affects how crowded it feels is how many people come with each patient.
Right, good point. Both Lifelines and one of the OPD etiquette guides brought this up. Look, it's natural to want support,
Of course.
but bringing, 3 or 4 people can just overwhelm the space really quickly and mess up the flow.
So what's the guideline there?
Well, one of the sources suggested ideally 1 attendant per patient. Obviously, there are exceptions, depending on the patient's needs.
Sure.
But it's also about being considerate, like offering your seat. If you're an attendant and someone else clearly needs it more, an elderly person, someone pregnant, someone looking really unwell.
That's a really important point, that courtesy of offering a seat. Okay, what about just keeping the place tidy? Cleanliness and clutter.
Yep, another key area. Lifelines and an OPD etiquette text both mentioned how leaving belongings spread out or leaving food wrappers around makes the place feel cramped and, frankly, less clean.
We've all seen it, haven't we? Bags on chairs, coffee cups left behind. It's not great.
No. So the guideline is simple. Keep your stuff together. Use the bins. And while we're talking about things we bring in, strong smells from food came up, too.
Oh, that's a good one. Lifelines mentioned that.
Yeah. What smells fine to you might be really unpleasant for someone else, especially if they're feeling nauseous or sensitive.
Definitely. Especially in a smaller waiting room. You bring in some pungent lunch.
Yeah.
Could be rough for others.
Exactly.
Yeah.
So best to avoid eating full meals there if possible, or at least be super mindful of strong smells. Another point from Lifelines, maybe less obvious, is about touching shared surfaces unnecessarily.
Ah, yeah. Hygiene. Makes total sense. Think about how many people touch those magazines, chair arms, maybe toys if it's a pediatric area.
Right. So yes, not following those systems. Big source of frustration. Trying to jump the queue or asking the nurse if you could just pop in quickly.
Yeah.
Unless it's a real emergency, it's just not fair to others.
Undermines the whole process.
Exactly. So wait for your name or number. Respect the order. Simple as that.
And one last, don't unnecessary movement.
Yeah, like pacing right outside the doctor's door, hovering, trying to peek in. It can be really distracting for staff and maybe unsettling for other patients.
Makes sense. Stay in the designated area until you're called.
Pretty much.
Okay, so that's a fair few things not to do. Let's flip it. What are the positive actions? The do's for good OPD etiquette? Punctuality seems like a good place to start.
Absolutely fundamental. Being on time for your appointment, multiple sources hit this. Lifelines, Quora, the OPD etiquette guide. It just helps everything run smoother and stops the waiting room getting unnecessarily backed up.
The etiquette guide even suggested arriving maybe 15, 20 minutes early.
Yeah, that gives you a little buffer. And crucially, if you know you're going to be late, call ahead. Let them know.
Right. That simple courtesy can make a big difference for their scheduling and for other patients.
For sure. Another huge positive is just patience and understanding.
We touched on this, but it's worth repeating.
Definitely. Lifelines and Quora both stress that delays happen in healthcare, emergencies come up, appointments run over. It's just the nature of it.
Getting worked up doesn't speed things up.
Not at all. So, like we said, maybe bring something to do, a book, some work, even just mentally prepping questions for the doctor makes the wait feel less like wasted time.
Good tip. And hygiene, again, on the positive side.
Yes. Practice good hand hygiene.
Whoa.
Wash your hands. Use that sanitizer we mentioned. Lifelines and Quora again. It's just crucial in a place where people might be sick.
Keep a little bottle in your bag. Easy.
Very easy. Okay, another big one. Respecting privacy.
Super important. People are there for health reasons, sometimes sensitive ones. They might be feeling vulnerable.
Exactly. So, as Lifelines and Quora pointed out, avoid staring. Try not to listen in on private conversations. Keep your own calls quiet and, ideally, private.
Just give people their space, mentally and physically.
Right. Foster that sense of comfort and discretion. And we mentioned using wait time productively, reading, working, organizing thoughts. Lifeline suggested this can actually help manage anxiety too.
Yeah, redirects your focus. Okay, what about interacting with the staff?
Ah, yes. Politeness goes a long way. Remember, they're often under pressure, speaking respectfully, even if you're frustrated about a wait. Quora users and the etiquette guide really emphasize this.
If you have a question, ask calmly. Don't take delays out on them, right?
Exactly. Blaming staff for things outside their control, like emergencies causing delays, isn't fair or productive. And finally, there was a good practical tip in the OPD etiquette text about where to ask questions.
Oh, yeah.
If you need info like about wait times or what happens next, go to the help desk or reception. Don't knock on the consultation room door.
Right. Let the doctors and nurses focus. Use the designated points of contact.
Precisely. Keeps things flowing and respects their work.
Makes total sense. And the OPD etiquette source also had a quick note about kids or elderly patients.
Yeah, just that extra bit of consideration. For kids, maybe bring quiet toys, snacks, water to keep them occupied and comfortable.
Keep them from getting too restless.
Exactly. And for elderly patients, make sure they have a comfy seat. Help them if needed, have their documents ready. Just being calm and reassuring yourself helps too.
Good practical tips. Okay, so we've covered a lot of ground here. If we were to boil it down, the key takeaways seem to be: watch the noise, respect space and privacy,
Limit attendance if possible, keep things tidy, be polite to staff.
and practice patience. It sounds like common sense, but maybe it's not always common practice.
Well, that's a thing. And it's worth saying again, this isn't just about rules for rules' sake. When we all make these small efforts, we genuinely contribute to a better atmosphere.
Right. More pleasant, more respectful, probably more efficient too.
Exactly. It helps create a more supportive setting, which is what you want when you're dealing with health concerns. Better for you, better for everyone else there.
Which leads nicely into our final thought for you, the listener. Think about this. If everyone consciously tried to be more considerate in waiting areas, how much could that actually reduce the stress and anxiety we often feel during hospital visits?
It's a powerful thought.
It is. So maybe consider, what's one small change you could make next time you're in that situation? One little thing that might just make the experience a tiny bit better for someone else sharing that space with you.
Definitely something worth mulling over.